Can people avoid expensive testing for the coronavirus by getting their results from a blood or plasma center? No, that's not true. A claim quickly spreading on Facebook alleges coronavirus testing costs in the thousands of dollars, and a way around the high cost is to find out for free by donating blood or plasma. The claim, for example, surfaced in a post where it was published on Facebook on March 3, 2020. The text in the post read, quote, "It's almost $4,000 to get tested for coronavirus without insurance. If you donate plasma, they will test your blood for free and pay you. They have to tell you if you come back positive for anything. Stay safe and fuck Big Pharma. Reposting for awareness." End quote. Facebook users saw this. A version of the story also is found on Twitter, claiming the US is charging over $3,000 per test while South Korea is offering free tests to citizens and non-citizens as a part of their emergency response. Here is a screenshot of a tweet, since deleted, but making that claim. Despite deleting that tweet, it still surfaces on Twitter. For example, quote, Korea is giving free tests to citizens and non-citizens as a part of their emergency response. The US is charging over $3,000 per test. Black Girl Magic. Biden 2020. At Remove Them for March 2, 2020. End quote. The information contained on both Facebook and Twitter is false, according to reports here, and here. While any trip to the doctor or emergency room can rack up a big price tag even with medical insurance, so far, the test available for the coronavirus is free. Only 2 agencies have been authorized by the U.S. Food and Drug Administration to test for the virus: the Centers for Disease Control and Prevention and the New York State Department of Public Health. Both evaluations are currently without cost to patients. After a series of questions and exams, anyone under suspicion for having contacted the virus has a nasal or throat swab, and the sample is sent the CDC or the New York State Department of Public Health to be tested for free. Blood and plasma donation centers do not have the test. The CDC works closely with state and local public health officials, the travel industry and others to identify and test people who may be infected. According to the CDC, 2 types of tests are performed on the samples it receives: molecular tests, which look for evidence of active infection, and serology tests, which look for previous infection by detecting antibodies to MERS-CoV. Serology tests are for surveillance or investigational purposes and not for diagnostic purposes. Here are the CDC's guidelines on specimen collection. And here is more information about the test itself. New York State recently announced the Public Health Laboratory and Research Institute Wadsworth Center, housed within the State Department of Health, will partner with hospitals to expand testing capacity to 1,000 tests per day statewide. Some companies are scrambling to come up with commercial tests for the virus, but none have been approved as of this writing, according to Bloomberg News. The Red Cross and plasma donation centers have strict eligibility requirements and a lengthy screening process for donating plasma or blood, including excluding people who are ill or have traveled out of the country to certain areas. According to information on the Red Cross website, quote, "Do not donate to get a test. If you think you may be at risk for HIV, AIDS or any other infection, do not donate simply to get a test. Ask us where you can be tested outside the blood center. The following symptoms can be present before an HIV test turns positive: fever, enlarged lymph glands, sore throat, rash. Do not donate if you have these symptoms. What happens after your donation? To protect patients, your blood is tested for several types of hepatitis, HIV, syphilis, and other infections. If your blood tests positive, it will not be given to a patient. There are times when your blood is not tested. If this occurs, you may not receive any notification. You will be notified about any positive test result which may disqualify you from donating in the future. The blood center will not release your test results without your written permission unless required by law, example, to the health department. We maintain a confidential list of people who may be at risk for spreading transfusion-transmitted diseases. By continuing this process, you consent to be entered in this confidential list of deferred donors if you are at risk for spreading such diseases. When required, we report donor information, including test results, to health departments, military medical commands, and regulatory agencies. Donation information may also be used confidentially for research related to blood safety. End quote.